Welcome to Unit 8, Introduction to Urinalysis and Body Fluids. We're finally getting to what I think is the fun part of the course, discussing the different laboratory departments and what we do in those.
The history of urinalysis is kind of interesting. Ancient Babylonian and Sumerian physicians first inscribed their evaluations of urine into clay tablets as early as 4000 BC. That was a really long time ago. Later, in ancient Greece, Hippocrates, often called the father of Western medicine, expanded on urine's importance. No other organ system or organ of the human body provides so much information by its excretion as does the urinary system, he wrote. By the late Middle Ages, the study of urine had solidified into the practice known as uroscopy. Medieval doctors associated nearly every known disease with urinary characteristics, and some would diagnose patients without even meeting them just by examining a bottle of their urine. A piss prophet was a sort of doctor who diagnosed patients based entirely on their urine by noting the color, appearance, smell, and even taste. A sweet taste indicated a high level of sugar and was recognized as a symptom of diabetes. After blood, urine is the most frequently examined body fluid. Why would urine be analyzed? Number one, it's an easy sample to obtain. You give the patient a specimen cup, send them to the restroom, and say, fill her up. There's no needles, no invasive procedures. Number two, it's a very cheap test to perform. The dipsticks that we'll talk about later can analyze tests for different areas of the body, which then checks for the overall health during a medical exam. It provides data to diagnose a wide range of disorders, and again, we'll talk about that in the next series of slides. The most common disorders that are diagnosed include urinary tract infections, often known as UTI, kidney disease, liver disease, and diabetes. The results of testing for any laboratory sample are only as good as the sample collected. I can be the best clinical laboratory scientist in the world, but if I receive a crappy sample, then the results may as well just be made up out of thin air. There's different types of urine samples that may be requested for testing. First morning is the most concentrated because you haven't peed all night, so it concentrates in the bladder. And this will give the most accurate results when using test results for diagnosis or monitoring of certain conditions. A random sample may be collected at any time during the day and is acceptable for routine screening. So we had the first morning and the random. And now let's talk about the techniques to collect the best sample of urine. A midstream collection is preferred, and it's collected by urinating the first amount into the toilet. You collect the middle of the urine stream, and then you complete urination into the toilet. By discarding the first amount of urine that is voided, we eliminate a lot of the bacteria and other contaminants, and we get what is strictly from the bladder. A midstream clean catch requires cleansing of the urogenital area prior to collection of the sample. This is crucial when collecting urine for a culture. Cleansing and allowing the first part of the urine stream to go into the toilet decreases the amount of contaminating bacteria to be collected. Again, there's what's called normal flora in the urogenital area, and this is bacteria that normally grows there. But if you collect it in the cup, it's going to grow on the plate as well and may overgrow pathogens. A 24-hour urine sample is a special test used to diagnose certain kidney disorders. The urine is collected for 24 hours in a special container. For the analysis of urine, there are three components to a urine examination, and we will discuss each of them: macroscopic, chemical, and microscopic. Back in the day, all three components were performed on every urine. In the modern laboratory, microscopic examination is not performed unless there is an abnormality in the chemical examination. And this makes sense. Let's work smarter, not harder. If everything is normal or negative on the chemical examination, what would you expect to be present in the microscopic that would be abnormal? Macroscopic examination includes the visual evaluation of a urine sample. So what we're going to do is note the color, and odd colors such as brown, black, red, etc. may indicate a serious medical condition. So yes, we use terms like light yellow or straw to record our observations. And then again, you would describe any abnormal colors or visualization with other words. The odor, although not noted on the results form, an ammonia odor may indicate an improperly stored sample or a urinary infection. Back in the old days when we used cloth diapers, and even with disposable diapers, if you leave them out, a changed diaper out, after a while you may notice an ammonia smell, and this is due to the presence of normal flora, normal bacteria, breaking down chemical components to produce that ammonia odor. In addition to color, another macroscopic characteristic is clarity. Normal urine is either clear or hazy. Cloudiness may be normal or may be an indication of a urinary tract infection or some other condition. Labs that note clarity will grade using words to describe based on the ability to read newsprint through the sample. So if you look on the very far left where it's clear, you can actually read the newsprint. If you look on the very far right, you cannot see a single letter in those words. And the description for this is turbid. So again, clarity is noted. Sometimes there may be a haziness to the urine because it's not a clean catch. And cells and mucus from the urogenital area may be in the sample. Chemical examination of urine is performed by dipping a strip which has numerous pads containing different chemicals into fresh urine. It's very important that it be fresh. Then observing the pads for color changes at specific time intervals. Instruments are available which detect color changes electronically in laboratories performing high volume urine testing, or even in doctors' offices. These tiny machines are very inexpensive, about $500, and they're robust. They last a long time. So if you look at this picture, there's an individual who has dipped the urine, they blotted it, and now they're comparing color changes at specific times. And it's crucial that you don't stop and note the color change or your interpretation, because you read these two at 30 seconds, this one at 45 seconds, these two at 60 seconds. So and then there's one that's read at 2 minutes. So you want to keep your eye on your timer and make a visual interpretation. Most dipsticks or chemical examinations are normal, or maybe they have 1 or 2 abnormalities. For the chemical examination, the following is a discussion of the most commonly performed urine chemical tests and the clinical significance. Clinical significance is terminology used to explain the significance of a laboratory result to the condition of the patient. For example, the clinical significance of glucose in the urine is that the patient may have diabetes. Laboratory medicine is not only about the performance of a laboratory analysis, but what that test means in relation to the patient's diagnosis and what other tests can confirm or refute the findings of that test. This is what makes our profession so much fun. I want you to be able to recall each chemical test and a clinical condition that it may indicate that's present. Glucose indicates diabetes. Bilirubin, liver disease. Bilirubin is a substance in the blood that is the breakdown of red cells in the liver. And when you get an excess amount, you turn yellow. And you may notice this, people with hepatitis, the yellows of their eyes, the whites of their eyes are yellow. It may also indicate bile duct obstruction or hepatitis. Hepatitis is inflammation of the liver. There's many, many causes of hepatitis. There's a whole alphabet soup For example, hepatitis A is fecal-oral route, and that's why when we have boil water orders, it's to kill microbes like the hepatitis virus. And then the remaining hepatitis viruses are transmitted through blood or body fluids. Ketones can indicate starvation or diabetes. So you get a little 2-year-old child come in, they've had nonstop vomiting and diarrhea. They may have positive ketones because they can't keep anything down. They're starving, and ketones is a byproduct of fat metabolism. Or ketones could indicate diabetes. Diabetics cannot use glucose for energy, so the body thinks they're starving, so they'll also start breaking down the fats. Specific gravity indicates how concentrated the urine is, which is maybe if a patient cannot concentrate their urine, this can be a clinically significant finding. But usually it means that it's a random sample and the patient is very well hydrated. Blood may indicate a urinary tract infection, trauma to the kidneys, you got a blow to the belly, or cancer. And I always tell the story that my dad, he was relatively healthy, but we noticed he was starting to lose weight. And so he went to the doctor, and the only abnormal finding was blood in his urine. It turns out he had kidney and bladder cancer, and that was what was causing the blood to go into the urine. Very important note is that a false positive may be due to menstrual blood. This test tests for blood. It doesn't know whether it's blood from the bladder or the kidneys or from a menstrual cycle. pH measures the degree of acidity or alkalinity of urine. This may be utilized in conjunction with other tests to diagnose diabetic acidosis or alkalosis. Now, this is way above what I expect you to understand what that means, but just know that's an indication for the pH of an abnormal condition. Protein indicates renal, or in other words, kidney disease. You should never ever have protein in your urine. It is always reabsorbed back in the body. Now, you may get, especially in women, a trace of protein, and that's because of the mucus present in the urogenital area. Mucus is made of protein. But again, you're going to get a trace, maybe 1+, but you get an extensive amount of protein, then that's a sign usually of kidney failure. Urobilinogen may be increased in hepatic liver disease or hemolytic disease. And hemolytic is the red cells rupturing. And what happens is sometimes there are conditions that occur in your body that cause your red cells to rupture. Usually it's an autoimmune process, meaning the patient is reacting against their own blood cells. They don't like them anymore. They destroy them. So we get the red cells. We'll get a positive in the blood, and then we'll also potentially get a positive urobilinogen. Nitrites indicate a urinary tract infection, and as I said before, when bacteria are present in the bladder, a bladder infection, they incubate there, and a byproduct of their metabolism is they change nitrates into nitrites. So the presence of nitrites in a urine is an excellent indication of a urinary tract infection. Leukocytes, also known as white blood cells, also indicate urinary tract infections. So when you put the three things together, you put leukocytes, nitrites, and blood together, if all three are present, then this would definitely indicate that a culture of the urine needs to be done. As you can see, something as simple as peeing in a cup can tell us so much about a patient. Positive or abnormal results would then indicate the need for additional testing to be performed. Microscopic examination of urine. After the chemical analysis is done, a portion of the urine is poured into a test tube, which is then centrifuged, meaning it's spun at a high rate of speed, so the formed elements will go to the bottom. The supernatant fluid is discarded, and a drop of the well-mixed sediment is examined microscopically. The beginning MLT students are mesmerized by the different types of structures, which can be seen under the microscope. I've learned to set a timer for them, or have them set a timer, because after a while the cover slip specimen will start to dry out, and that will cause additional structures to appear which are in no way related to the original sediment. Cellular elements, crystals, and parasites can be viewed, classified, and in some cases enumerated or counted. Microscopic exam is often used to confirm the findings of the chemical exam, such as the presence of leukocytes or red blood cells. So if on the dipstick you get a positive leukocyte or red cell, when you look at that sample microscopically, you better see leukocytes or red cells. If not, something's wrong and you need to repeat the test. So this is an example of what I would call a dirty urine, meaning there are so many different formed elements that shouldn't be there. For example, you see the little arrow pointing at Trichomonas. This is a parasite, and it's frequently seen in the urine of females. And it is a sexually transmitted disease, and this little parasite is so cute. When you look at it under the microscope when it's alive, it has little flagella that allow it to swim around, and it visits different structures in the urine sediment. Yeast buds can indicate a yeast infection. When women take antibiotics, it not only kills the bad bacteria, but it can kill the good bacteria. And a side effect of antibiotics in women is an overgrowth of yeast because there's nothing to keep them in control. And so you can see the little yeast buds. They're very tiny. PMN is another term for polymorphonuclear white blood cells. And this is a type of white cell which when present may indicate an infection. And so they pointed to a couple of them, but there's many others in this field. And so usually we do enumerate these and we list what is normal. So 0 to 3 PMNs per microscopic field is normal. But when you exceed that, and you look at many different fields and you get you have to do an average of them. Squamous epithelial cells is the only normal finding in this urine, and you can see it's almost in the center of the screen. Again, it's labeled, there's an arrow pointing to it. So again, it's just fascinating what you can see during the microscopic examination of urine. There are so many interesting things to see during the microscopic examination of urine sediment. As an MLT, you will learn to identify normal and abnormal crystals which may be present in the urine. The unique characteristics, causes of formation, and clinical significance, meaning are they associated with the disease or not, will be memorized during the MLT course. The most commonly found crystals are associated with your diet, and if you have if you've eaten some acidic foods, this can cause the formation of acid-base crystals. If you eat very alkaline foods, this can result in another type of crystal, and they usually form as the urine cools to room temperature. But if you'll look on the right-hand side, you see normal crystals versus abnormal crystals. Some of these are so beautiful. You just want to look at them and go through different fields to see the variety. In the modern laboratory, urine dipsticks are rarely read by hand anymore. Don't get me wrong, the machine may break, so you need to know how to do the manual, or you may be in a very, very small facility. But for the most part, the strips are read by an instrument. Automated readers automatically interpret the results and print out the results, increasing the accuracy. One of the most difficult paths to read is protein, and you have to read it under really good light. And keep in mind, if you call something abnormally positive, then that reflexes to additional tests. Those additional tests cost money, so you always want to be very, very careful. So sometimes if I'm unsure of the interpretation of a certain pad, I will borrow somebody else's eyes. But again, that's why automation has played a crucial role in really keeping track, because again, you read this one at 15 seconds, this one at 30 seconds, this one at 60 seconds, and then remembering all those pads when you go to write them down can be very, very daunting. The dipstick pads have to be interpreted very quickly at the correct time, again, which for you as a newbie would be very difficult. So blood and urine are the two most commonly tested samples, but there are additional body fluids that are evaluated in the clinical laboratory. Testing performed will be based on the fluid being examined. These fluids are collected by physicians and require an invasive procedure to collect, which is not you. Due to the difficulty and nature of the fluids being examined, it is crucial that great care be taken when handling them and that the analysis be performed as quickly as possible. These fluids are very precious due to where they came from and the procedure to collect them. For each of the following fluids, I want you to know the source and the clinical conditions that are diagnosed. As an introduction, the following slides will provide a description of the purpose of the fluid, a brief description or illustration of the collection of the fluid. You will learn about the specific lab tests performed on body fluids and clinical significance in future MLT courses. The overview illustrates the variety of samples other than blood and urine which are submitted for laboratory testing. Pleural fluid, pleural means lungs, and this is an abnormal buildup of fluid in the lungs that can be a sign of serious illness in the patient. Fluid is obtained from the lungs in a procedure called thoracentesis, and I want you to know that. The fluid is sent to the laboratory for analysis to determine the cause of the fluid buildup. The physician is then able to make a diagnosis based on the results of the test. And so you see here the patient is upright and leaning on a table, and the doctor will determine where to push the needle through to puncture the lung and then collect the fluid. And as you can see, the fluid can be collected in either a bag or a syringe. My most frequent container that I receive in the lab is a liter bottle, and some patients have so much fluid in their lungs that 2 liters have been submitted. And one of the signs of fluid in the lungs is when the patient lays down, they can't breathe, but when they sit up, that creates a space at the top of the lungs that allows them to breathe, not easily, but breathe. So pleural fluid is from the lung collected by thoracentesis. Cerebrospinal fluid, also known as CSF, is a clear, colorless body fluid found in the brain and spinal cord, and one of its purposes is to provide a cushion or buffer for these organs. The fluid is collected by lumbar puncture, which is also known as a spinal tap. We're removing fluid from the spinal cord. The testing is performed usually for diagnosis of infections such as meningitis. I had a lumbar puncture done, and one of the side effects may be that the hole doesn't automatically stop up and you can leak CSF into your tissues. And so how I knew that was I got this severe headache, and when I laid down, the headache went away. So what had happened is my brain would sink when I was standing up, and then when I laid down, there was enough CSF there to cushion my brain. And what they did to fix it was a blood patch, which is really bizarre. They sterilely collected blood from my arm and injected it into my spinal column, and that the coagulation factors then were able to stop the CSF from leaking out. Peritoneal fluid is a liquid which acts as a lubricant in the abdominal cavity. A variety of conditions can cause inflammation of the peritoneum, which is called peritonitis, or excessive accumulation of fluid, which is known as peritoneal effusion or ascites. Peritoneal fluid is collected by paracentesis, and laboratory testing is crucial in determining the cause of the excess fluid buildup. Peritoneal fluid, abdominal cavity, collected by paracentesis. Amniotic fluid is the fluid that's produced to cushion the developing fetus and serves to facilitate the exchange of nutrients, water, and biochemical products between the mother and the fetus. Fluid is obtained by amniocentesis, and it's done with sonography or ultrasound, where the doctor can determine the best placement of the needle so they don't puncture the baby by mistake. The fluid is analyzed to assist in diagnosing problems with the developing fetus. It can be used for genetic testing. It can be used for chemical testing to determine different types of diseases that may be present. Pericardial fluid. An abnormal accumulation of fluid in the pericardial cavity is known as pericardial effusion. This can affect heart function. Pericardiocentesis is the procedure used to remove the fluid. The fluid is sent to the laboratory for analysis to help diagnose the cause of inflammation of the pericardium or fluid accumulation. So we have the heart, then we have this sac, and then we have the cavity that contains it. So what happens is the buildup of fluid can occur, and this makes it difficult for the heart to beat to the extent, if too much fluid is there, that the heart stops beating. And this is known as cardiac tamponade. And I think you've seen at least one medical show where this has happened and the heart stops, and the intern or the doctor, just plunges that needle into the heart sac and pulls the fluid, and the heart starts beating, and everybody's happy. Seminal fluid, also known as semen, is self-collected by the patient. There are two primary reasons for analysis: infertility and vasectomy success. Infertility: when a couple has difficulty conceiving, the male partner should be tested first. Providing a semen sample is non-invasive and has no risk compared with the evaluation of the female, which is an invasive procedure used to look at the uterus and look at the fallopian tubes and the ovaries. Counting and evaluation of sperm. The evaluation, we note the movement, we note the morphology, how they look, if there's any weird forms present, is performed to determine if male infertility is the problem. If it is, the couple can be counseled on other alternatives for getting a child. Vasectomy. A vasectomy is a medical sterilization procedure for men who are sure they do not want future children. It is crucially important that the male have an analysis performed post-vasectomy, after the procedure, as the vas deferens has been known to grow back together, resulting in an unwanted pregnancy. And I can't tell you the number of stories I've heard from the clinical world where a man failed to go back and be checked, and yes, they had a surprise package. And of course he blames his wife because he had the vasectomy, and sure enough, when they did additional research, they found he did not go back. The vas deferens did grow back together, and yes, he was capable of fathering another child. Absence of sperm validates a successful procedure. So you have semen. A component of semen is the sperm. So a post-vasectomy analysis will show that there are no sperm present. Sputum is a thick fluid produced deep in the lungs. The sample is collected by having the patient take deep breaths and coughing hard to bring up the viscous fluid from the lower lungs. The most frequent lab test is a culture to determine what bacteria are growing. And this is the only sample in the clinical lab that grosses me out because it's really mucoid and it hits your gag reflex right in the back of your throat. Synovial fluid is a viscous fluid found in the cavities of synovial joints. It's removed by arthrocentesis. The principal role of synovial fluid is to reduce friction between the articular cartilage and joints during movement. The presence of uric acid crystals indicates gout. A high white blood cell count in the fluid may indicate arthritis, gout, or rheumatoid arthritis. You've now learned there are many other body fluids which are routinely analyzed by the clinical laboratory besides blood. You've been introduced to the names of the fluids, the procedures utilized to collect the fluids, and in some cases the clinical significance of laboratory testing performed. Most of the body fluids discussed here are collected by physicians or the patients themselves. If a patient collects the sample, it's very important to give them verbal or oral instructions as well as written on paper instructions for them to follow. Always handle these fluids with extreme care and precautions, as most are very difficult to obtain and may contain highly pathogenic organisms.